They fly in some of the UK's most dangerous skies.
I'm being smashed about to get into the valley.
It's going to be bumpy, it's going to be turbulent, guys.
From high-rise city centres...
OK, commit to land, over the H.
...to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, over?
The crews of Yorkshire's 2 air ambulances risk their lives...
Gone unresponsive.
It's just gone unresponsive on us.
...to save yours.
There's potentially fatalities involved.
There it is on its roof.
Delivering intensive care by air.
Is he breathing? No, he's not breathing.
The cow trampled me and then came back again and again.
No matter how critical the case...
This is the first time anything like this has ever happened.
He's moving his arms around and he's sweating buckets.
...however risky the place.
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee.
What's your name?
Doing their jobs with Yorkshire grit.
It is from Medic 2 at the patient's side, however.
Humour.
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
And compassion.
OK, chick, we're just going to get you out, all right? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
Now have a quick feel of your tummy. Any pain there?
A car careers off a motorway, leaving a young woman seriously injured.
She's going to be travelling at 70 miles an hour plus.
The team raced to help a climber who's fallen 20 feet off a rock face in the Peak District.
You're always worried about head injury, that's the main thing.
Taking a nice deep breath for me.
And a man's ribs are crushed after falling off a ladder during some DIY.
Any pain in your tummy at all?
Go ahead.
It's mid-afternoon at Yorkshire's Air Ambulance HQ, and on the dispatch desk, Steve has spotted a job.
Sorry, guys, I'm going to send you out on this. M62 near goal, car roll over, then gone through a fence.
Paramedics Paul and Rachel are racing east to the scene of a serious motorway crash with Dr. Chris.
What are we going to? M62. But what crash? Yeah.
Roll over into a fence. On the way to the job, the only information we were given was that the car had come off the motorway at about 70 miles an hour. It did look like it wasn't going to be a particularly pleasant job.
From the Nostell Airbase, flying time to the crash is 8 minutes.
Steve's just tasked us to a job on the M62 near Goole. The reports of a car that's been in a collision and left the carriageway. Statistically, motorways are probably the safest roads to drive on, but certainly if they lose contact with the road and end up coming off, with the speed there can be some pretty serious injuries.
5 people die on Britain's roads every day, and more than 70 are seriously injured. The team are heading to the M62 Transpennine motorway, one of the busiest motorways in the north.
The one thing we have to be very careful around working on motorways is our own safety. You know, things can go from bad to awful, in split seconds, so we'll be trying to make sure that the motorway's closed and having good visibility to make sure that we've identified all the hazards.
En route, the team get an update from Steve on the air desk.
I don't know if you can see the incident, but they're running on a second detail now where it's apparently where the patient is.
Apparently it's an obvious external leg rotation, fractured leg over.
Pilot Gary is circling the crash site. A car has careered off the motorway and ended up on a parallel A road.
Parking on motorway, on the road?
Yeah, just that bush there, that's all. I'm going to be downwind. Good left. 200 landing on. No good. Both jump out the doors. Roger. Okay, cleared out.
When we arrived on scene, we could see the car was a real mess. There was damage to all 4 corners and damage to the roof as well. So that can be a sign that this is going to be a pretty serious incident.
Their patient is lying in the road by the wreckage of her car. Passing motorists stopped to help and stayed with her.
Hello, sweetheart. I'm Rachel. I'm one of the paramedics, OK, and this is Dr. Chris. What do we call you?
Gabby.
Gabby, and do you know what's happened, Gabby?
No.
All right, sweetheart. All right, sweetheart. Do you remember what happened?
No.
Yeah, she's come off the motorway over all the grass and onto the
Did
road.
you witness it?
We got here just after the car was here. Gabby had got herself out.
I know, sweetheart.
19-year-old Gabby Clarson's car smashed through a fence and rolled several times before coming to a stop more than 100 yards away.
At the moment, can you just feel the pain in your leg? Have you got any pain anywhere else?
My stomach.
Your stomach. Can I have a feel down the back of your neck? Have you got any pain in your head?
No.
Any pain in your neck?
No.
Any pain down the back of your neck?
Well done.
No.
Down your back. All right, sweetheart. Have you got any pain round here?
No. My hip on my right.
The hip on your right. This side?
Yeah, look, when you push on it.
All right, sweetheart. What about this side?
No.
Okay, and I'm just going to have a quick feel of your tummy. Any pain there?
Yeah.
It's not clear whether Gabby was flung from the car as it rolled or if she managed to drag herself free of the wreckage.
Can I just come underneath?
I can't move.
Any pain there?
No.
She has serious injuries and multiple fractures to her leg, which has rotated 180 degrees.
Tender all over her abdomen, tender on her right hip. She's got an obvious fracture dislocation of that foot. In quite a lot of discomfort, no neck, no back pain, but she doesn't remember anything that's happened.
What do you want me to do for you, mate?
I think we just need to get her up and get her lying in and get her some pain relief because she's in absolute agony. Right, sweetheart, we're going to be coming at you from all angles now. Chris is going to bob a line in you and get you some pain relief. I'm going to do some observations on you and then we're going to look at getting you up off at floor, all right?
Right, Gabby, it's going to be a bit of a scratch on your wrist, OK?
Dr. Chris is putting a cannula in Gabby's arm. She's going to need powerful intravenous pain relief before they move her onto a stretcher.
Just thinking about giving her a bit of fentanyl. You happy with that?
That's probably the best one, isn't it?
Now, Gabby, we're going to give you a drug. It's like morphine. It's a bit stronger and it's a bit cleaner. Doesn't make you feel sick.
So, Gabby, where were you going today?
Home.
Home. Where's home?
Grimsby.
Grimsby. Do you have any medical problems, Gabby? No. And did you feel all right this morning? Yeah? Not been feeling unwell at all today?
No.
Do you mind if I cut your jumper, sweetheart? Right.
No other vehicle was involved. Paramedic Paul is checking the wreckage to try to understand what caused the crash and the mechanism of Gabby's injuries.
It looks like from the damage to the fence that she's been driving eastbound on the M62. She's then, for some reason, left the road and completely gone straight across the grass verge through that fence, and then as she's hit this road, she's rolled a few times, causing the damage to the car. So obviously, if she's had a bit of a blackout or something at the wheel or a fit, and obviously she's caused that, she's going to be travelling at 70 miles an hour plus. So obviously she's very lucky to be in the situation she's in at the minute where she's able to talk.
All her obs are looking really nice. So BP 124/82, heart rate of 100 and stats of 99 on air. So everything else is looking good. Just the ankle and then obviously a good look at her abdo-pelvis when we get her moved.
She had quite a nasty femur fracture, so that's a fracture of the main thigh bone, but also an open fracture of the leg, and that's where the bone's broken and poked through the skin. You know, the risk of that is there's infection there and blood loss or damage to nerves and other vessels.
We're going to need to put it in summit while we move her out. Yeah.
The fractures are so serious, the team will need to straighten the leg where she lies.
I'm going to move your leg slightly, but it's going to be really uncomfortable, OK? We've given you some pain relief, but whatever I do, it's going to hurt for the time being, OK?
Grip my hand as tight as you want it. Keep gripping it, keep gripping it. That's it. That's it. That's it.
Oh, it hurts up here.
It hurts up there?
Well done, well done.
Where's it hurting?
At the top. Oh my God. Please stop.
Are you allergic to anything, chick? You're not allergic to penicillin or anything, so we're going to give you an antibiotic. Right, sweetheart, this is going to be uncomfortable again, OK? But what we're going to do, we're going to get this board underneath your legs, then we're going to slide you down it, all right, rather than moving you about.
OK, ready?
Are you ready?
Ready, slide.
Oh my God.
Keep that leg straight.
I'm trying.
Take that leg
No. Come on.
Right, so lie you down flat, ready?
I can't.
Okay.
Hurting my hips.
Right, sweetheart, I need you to lay down on that. I know it's...
Really hurting my hips.
Come here, squeeze my hand, mate.
Paramedic Paul has the difficult task of calling Gabby's mum to inform her.
Your mum says she's going to come down to the hospital and see you.
And she loves you.
That's pretty hard, you know, ringing somebody out of the blue and telling them bad news. Often people be at home worrying, wondering if something's happened. You know, their loved one may not have come back on time. So sometimes having some news is better than having no news.
Right, we're going to move your leg again, sweetheart. Just bear with us. You're doing really well. This might help relieve some of the pain, all right?
Right, I'm just going to just gently pull your leg, OK?
Using force and a Kendrick splint, Dr. Chris is pulling Gabby's broken leg straight.
Squeeze my hands. Squeeze my hands. Yeah.
He's done it. Gabby's leg is realigned, reducing the risk of internal bleeding from her fractured bones.
So the painkillers that we're giving you, sweetheart, will reduce your pain, but it's not going to take it away. The only thing that'll take that away is once you've had an operation, OK? So we've just got to make you comfortable. I'm going to leave your hat on as well, because, one, it looks cool, and two, it'll keep your head warm, yeah?
Ready, steady,
Gabby's made this journey home many times, but today, something happened to cause this crash. The passing motorists who stopped to help are shaken.
It was a complete shock, yeah. We were just talking about getting home and walking the dog. It's not what we expected at all. The gentleman wasn't local, he was calling the emergency services, so he didn't really know where we were. So I took over that call and sort of got the location to them, and then my wife is trained first aider, so she was just keeping her company and making sure she was okay.
You're doing really, really well, Gabby, all right?
With this patient, we just needed to load and go. She could have had hidden injuries. She could also have had a medical event that caused the accident. So the best place for her was hospital.
They're going to fly her 20 miles to the Hull Royal Infirmary.
Is it still really sore? Yeah. So we give you a little bit more painkiller, and then we're going to give you another drug, OK? And the other drug is an antibiotic.
Hi, love, is that Hull? Hiya, it's Rachel calling from Helibed 99. Hiya, we're wanting to bring to you a 19-year-old female who at 14:25 was involved in a high-speed rollover from the M62. So injury-wise, she's got a high fractured femur and a fractured left ankle. She was on the M62 doing about 70, and she's come off the M62 up the embankment and then onto an A road where she's rolled. Yeah, she's not sure as to why she's come off the motorway though. She's got no recollection of that.
7 Golf Tango into control airspace, radar control service.
At a flying speed of 160 miles per hour, it's just 9 minutes to the major trauma centre at Hull.
OK, guys, ready, and slide.
Gabby is lucky to have survived the crash. Only scans by the waiting trauma team will reveal the full extent of her injuries. She'll need surgery, and she could be months in recovery. At Nostell Air Base, Helibed 99 is being scrambled to the Peak District.
Autopilot, auto trim, stern in.
Pilot Jeff has paramedics Rachel and Matty quickly airborne. They're being called to a man who's fallen 20 feet off a cliff edge.
We have just been activated to a gentleman who's apparently fallen whilst out walking. We don't have a lot of information. It is down towards the Peak District, so it's just over our border into Derbyshire.
The new bit is that somebody's fallen. It's all a bit vague. I'm not quite sure who the call's coming from. It's a fallen walker below Robin Hood Cave.
Roger, that's all copping, mate. We've got 2 minutes out. I'll call when we land in.
It looks like it's nowhere near the road, doesn't it?
Mountain Rescue are also racing to the scene, but the teams have no precise location for the patient.
It's that cliff, isn't it? It's a cliff all the way across there.
The helicopter is circling the Peak District's famous gritstone escarpment, Stanage Edge.
If he's fallen off that ain't 10 metres. The area where the patient was a cliff area with lots of rocks and fallen rocks. Potentially, if somebody's fallen from that, they would have really significant injuries.
Is that an MRT there, red top, with a yellow bag on?
I don't know, because they don't look to be with.
It looks like there's people climbing all around though. They've got florist stuff on us, haven't they? So if you go right of that, there's more people. But yeah, I bet it's one of them that's fallen.
Their patient has had no medical care. Rachel and Matty know they need to find him fast.
Yeah, I've got that left, mate. Air desk from 99, we've landed at sea.
When we landed, we couldn't see where the patient was. It was a really big area and there was quite a lot of area to search. So because we couldn't find them, we ended up just having to get out and go look for them on foot ourselves.
So where do you reckon he is, over that way?
MRT are saying they've already got to him.
It's a long walk to the injured man and slow going over dangerously rocky ground.
They're up there, aren't they? Ah, he's over that way.
A quarter of a mile away, Mountain Rescue have begun treating the patient.
Hi. Is it stable? Hello, sweetheart. Well, I'm Rachel, this is Matty.
Hi, mate. Paul was doing something incredibly epic up there.
He was sending it to the extreme.
49-year-old Tom Brunt was climbing the rock face when he fell 20 feet and landed on a large boulder.
Complaining of discomfort in left butt cheek, top of pelvis. So we have popped the pelvic binder on, popped him in the backpack, and we just about to take him out of it.
Yeah, okay, fair dues.
The thing is, I noticed his pupils are a bit small, but he wasn't wearing a helmet. He said he did knock his head, but he's not complaining.
But he hadn't had any head, and you can't see any head injury that you're aware of.
Tom's pain could indicate a fracture.
Right, well, my colleagues are sorting out how we're going to get you down, young man. Am I all right to do your blood pressure and a few other quick checks just while we've got a couple of minutes? Yeah.
Tom and his friend Royston are veteran climbers with 30 years' experience.
Tom fell from Robin Hood's buttress direct. He was trying to stand up, his foot slipped, and the nut he placed, which is a nut I've placed many times myself, ripped out of the rock, and he fell and hit his pelvis. It was possible that he'd hit his head on a rock. You're always worried about head injury, that's the main thing.
Brilliant. 134, 74. Right then, young man, let's get you down off this hillside, eh?
The helicopter was on top of the hill and we didn't want to go back up there. So the mountain rescue guys helped package the patient and get him down the hill safely.
Medic 2 to pilot.
Yeah, go on, mate.
Yeah, mate, MRT are going to be ready for you down bottom.
Rachel is arranging the repositioning of the helicopter to flat ground below. It's closer to the patient, but Tom still needs to be carried there.
We're all good to move?
Yeah, fine. Ready on you guys.
He's got a left-sided hip injury, maybe a pelvic injury. It looks like he's fallen quite a significant height.
If Tom's pelvis is fractured, it can cause life-threatening internal bleeding, and he'll need careful handling from Mountain Rescue to get him over this rugged ground.
Just a good job Mountain Rescue here, because I don't fancy mine or Rachel's chances of lifting him back up to aircraft.
Across Yorkshire we've got lots of different mountain rescue teams and they are absolutely amazing. They're all volunteers and they really help us out when we need it, when we've had patients stuck in the middle of nowhere and nowhere near a road. Oh yes, we've got a helicopter, but sometimes it can still be a long walk to them. So we really do rely on them to help manoeuvre patients to where we need them to be.
We'll have a quick look at him, make sure nothing's changed.
It is now 2 hours since Tom's fall. Rachel fears he could deteriorate at any moment.
Right, sweetheart, I'm just going to lift your top up and go up your top, and then I just want you to take some nice deep breaths from me if possible.
That's 99, pulse 48.
Yeah. I'm just going to have a quick check and make sure there's no bruising or anything coming up. I can't see anything. There's nothing obvious. There's nothing obvious in his groin.
All right, mate, it'll be a sharp scratch. Keep nice and still for me.
Shall I draw some TXA up?
They're giving Tom TXA, or tranexamic acid. It'll help stem any internal bleeding until they get to hospital.
Is anything changing? Because you look like you're grimacing a little bit more than you were before.
No, not really.
It's time to fly.
Head first into there.
And lift.
How are you feeling, my love?
I'm feeling okay, just a bit sort of a little bit shivery.
Yeah, okay.
Hiya, mate. Our ETA to Northern General will be 10 minutes. That is 10 minutes over.
9 minutes, guys in the back. Oh, mate, iPad's away. I've got eyes out.
I like the outdoors, but doing this job's made me more aware of the dangers that are involved. Safety is paramount. I don't just go rushing into things like I maybe would have done.
It's just a short flight to hospital in Sheffield, where a full trauma team is ready and waiting to take over Tom's care.
I'm going to stick it over there.
Are you still feeling really cold?
Oh yeah, I just feel a bit wobbly and a bit shivery.
His injuries are serious, and his climbing days may be over.
Guys, shall we go to Wakefield?
At Air Ambulance HQ, Matty is listening in to a painful 999 call.
I can't speak.
A man has fallen doing DIY at his home.
Yeah, I think we should.
In under 5 minutes, Matty is on board HeliMed 99 with paramedic Andy and Dr. Paul.
Radios and lights. Radios and change lights on. Autopilot. Engaged. Auto trim. Engaged. V21 departure out of here, going to the west.
It's a short flight for the team.
So bloke who's fallen off a ladder who's got quite bad difficulty in breathing in background.
Okay.
Sounds like he's got a nasty chest injury.
So where the address was plotting, it looks like there's some fields out to the east. We can break through one of those gardens to get to the address, potentially.
Alright, you got the M1, 30 seconds out. Is there an ambulance? Looks like an ambulance there.
There were 2 allocated.
Oh, yeah, seen you. Yeah, that's got to get it.
Every year, over 40,000 people are admitted to hospital after falling from a ladder.
Happy?
Yeah. There might be a gap to 1 o'clock, Matty.
Okay, mate, we'll try up that way. Cheers, pal.
In 69-year-old Les Swift's home, local paramedics are giving him oxygen after a stepladder snapped and went from under him.
Les, I'm Matty, this is Paul, you've obviously met Julie already. Can I have a just quick check over you, is that all right, yeah? You stick your tongue out for me? Good man. Taking a nice deep breath for me? You can't. All right, mate. I'm just going to have a quick touch on your chest, OK? You take a breath for me?
CCTV captured the moment Les fell 10 feet to the concrete floor while clearing out a carport.
Paul?
Yeah?
You get IV access for us, mate, and some
I'm on it.
analgesia here. What we're going to do is we're going to pop a needle in your arm, I'm going to give you some strong pain relief, help you with that breathing, OK? Is this fresh air helping that my colleagues have given you?
A little bit.
OK. Any pain in your tummy at all?
It looks like Les broke several ribs in the impact.
Guys, reduce air entry on the right base, good air entry on the left. A little bit difficult to auscultate just because I think he's struggling with the pain. A little bit of bruising on that right-hand side, couldn't feel any crepitus. So, plan is, sir, give you some strong pain relief, that'll help you with your breathing, and then we'll be taking you off to hospital, OK?
Les was alone when he fell, but managed to stagger into the house to tell his wife.
Les, I've just given you some very, very strong pain relief, OK? When we get in the ambulance, I'm probably going to give you some more medication as well, all right? You're on a blood thinner. You've taken quite a whack to the right-hand side of your chest. You've got some other organs under there that we'd be a little bit worried about. So we're going to come with you in the ambulance to hospital, OK? But we're going to look after you. Julie's going to look after you. Me and Paul look after you as well, OK? But I think if we lay you down flat, it's going to make your breathing a bit worse. So it's just going to be a bit of a trade-off, all right? So I think we'll try and keep you sat up as best we can, but we just need to be mindful of any other injuries. All right, mate?
Matty suspects Les has a punctured lung, and he may be bleeding internally.
Should we give him some TXA in the DCA? Yeah, do that en route. Any questions at this point? Yeah, OK, we'll do that, OK? Your cat's very well behaved.
Oh, yeah.
Matty is trying to keep Les calm, but his oxygen saturation levels are falling fast.
50 mics of fentanyl. We're going to give him some TXA and some more in DCA. Got right-sided chest injury, queer a bit of liver underneath. Low sats, reduced air entry. 93. OK. There we go, my buddy.
A simple DIY task has left Les with serious injuries.
Okay, pretty steady roll.
He's going to hospital by road so he can be kept upright on the journey.
So this young man's fallen and he's got a significant right-sided chest injury. So the local hospital to here is Pinderfields, but that can't deal with major trauma. So we're going to bypass that and go to Leeds General Infirmary, which is the nearest major trauma centre. So he'll get some more specialist interventions when we get there.
Injuries-wise, he has got reduced air entry on the right side, probably some rib fractures, plus or minus pneumothorax, maybe hemothorax. All right. See you later. Cheers.
How are we doing with that pain, Les? Ready for some more pain relief? I'll just give you a bit more, yeah?
It's been a distressing morning for Les's wife, Valerie.
Les, just let your other half know that you're all right, OK. It's not the pain in your chest, it's the telling off you're going to get when you're back about being up that ladder. Right, I'm going to shut you in, Les, all right? You happy if I go to the front, mate? Yeah, cool. All right. He's fine. He's OK, my love. All right. Like I say, he's got this chest injury. He's a bit better than he was before, isn't he? He's chatting away. He looks in a bit less pain. OK. We'll get him sorted. OK. All right.
Thanks very much.
All right. Okie dokie. See you later.
Paul and Matty will travel with Les. There's a strong chance he could deteriorate en route. He needs hospital care. Fast.
Ambulance service, is the patient breathing? Okay, tell me exactly what's happened.
It's a freezing cold day, and Yorkshire's ambulance service is stretched to the limit.
Are you with the patient now?
Okay, I'm organising help for you now, so stay on the line. I'll tell you exactly what to do next.
This might be one for you folks. Lancet reservoir, so it might be an access issue.
On the air desk, dispatcher Dave has spotted a job that could use the air ambulance.
They've said they're a mile from anywhere, and it looks rather steep, so helicopters going from here.
Autopilot is engaged. Flash trim. It's staying. Advise down. Yeah. Brief. Roger.
Paramedics Matty and Kit are heading for a remote stretch of moorland in South Yorkshire's Peak District. On board with them is Dr. Neil.
We have been tasked to a male mountain biker who's come off his bike on a remote moorland bridleway towards the north edge of Lancet Moors. So he's awake and talking, but he's got a back injury.
Flying at 160 miles per hour, Helimed 98 will be at the cyclist's side in just 8 minutes. They'll be the first medical team there.
Mountain Rescue are very proficient and active in all of the sort of rural locations, but it takes them a time to mobilise, and they're predominantly walking from the roadhead to scene, so it can be an hour or two before they can get on scene.
On the air desk, Dave is coordinating rescue teams.
I've spoken to comms about a vehicle to back you up. At the moment, they've got 20 outstanding emergencies that they can't cover.
Yeah, Roger, no worries. We've got an ETA of 6 minutes. I appreciate the stacking calls, but we might need backup.
Their patient is somewhere in the vast expanse of cold and exposed moorland below. Luckily, pilot Jeff knows the area well.
I think it's going to be on this path here.
Yeah, visual.
Just there.
It will be a tricky landing on uneven, heather-covered ground.
I'm watching the tail. You just open that door, kit, and just make sure that's see what if this kit's skid on the right sink excessively. Go down. How's that look? Looks good. Thank you very much.
Hello. The biker's worried brother was cycling with him when the accident happened.
His lower back that he previously bumped before. Is it Richard?
Yeah.
How are you doing? Kit and Neil.
It's my lower back that's hurting.
I'll go and get shelter. Okay.
41-year-old company director Richard Campbell is in a lot of pain. He was doing 30 miles an hour on his electric bike when he came off on the rocky track and landed on his back.
My front tyre went one way, my back tyre went the other, and I came off and I think I smacked my back on the actual lump itself, my lower back.
It's late afternoon and temperatures are dropping rapidly. Richard has been lying injured on the freezing moor for over half an hour.
We need to prevent him getting cold because patients exposed to elements don't tend to do very well in trauma. So they're trying to get him nice and warm, get him packaged.
Dr. Neil will check him over under a temporary shelter.
Any tingling, numbness, pins and needles?
Just my back hurts.
But it's not going down your legs now?
No, I've not got no shooting pain. It's just a really dull pain in my back. I'm glad I didn't hit a rock, but it was as bad as it could have been.
Well, what we're going to do is wrap you up, get you warm, and get you off the hill.
Perfect. Let's do it quick.
Rocket science.
Let's do it.
All Richard's symptoms point to a worrying back injury. Kit's giving him gas and air for the pain.
If you've ever been scuba diving, it's just like one of those rigs, yeah?
Right.
If Richard's core body temperature drops by just 2 degrees, he'll be at risk of hypothermia. The team need to work quickly to get him off the moor.
How are you doing, Ray?
I'm all right. I'm not. I'm in pain now.
With perfect timing, the local mountain rescue team have arrived.
Hello. We're ready to carry now, if we've got enough people now.
Richard is wrapped in the team's Flectalon, a high-tech bag designed to capture body heat and quickly warm up the patient.
All out, straight over the bog to the helicopter.
Wheel right a bit.
Go around that way. Yeah, nothing there down to you, Mike November 02, ordered leader receiving over.
Richard cycles these moors regularly, but today his ride is ending with a short flight to the nearest major trauma centre.
Because of the slope, and because of the nesting birds, I'll do a vertical.
By air, it's a smooth 5 minutes to Sheffield's Northern General Hospital.
But on the left. Roger. Weather's more or less the same as it was last night as well. It's going to stay more or less what we've got now.
The team are regularly called to mountain bike accidents.
I picked another mountain biker off the same track, but he was right at the top. Every little helps and all that.
We've only got a couple of minutes out to Northern General, mate.
Everybody locked and tight?
Aye, sir.
Yes.
I can see high-vis people.
Yeah.
Richard will soon be heading for scans to his spine.
Oh, good left, mate.
To avoid worsening his injuries, a specialist trolley will smooth out any bumps on the way into the warm hospital.
Do you want me to pull the other end?
His injuries are serious. They may be life-changing. A low wet weather front is sweeping across Britain's biggest county. The Yorkshire Dales are shrouded in mist.
Radios and lights.
Radios will do once airborne lights are on.
Flying conditions are not ideal, but at RAF Topcliffe in North Yorkshire, paramedics Lisa and Gemma have an emergency.
Good left.
We'll lift into hover and I'll probably just turn around. It looks like there's no wind at all, so I'll just go left up the taxiway.
Okay.
The weather on this particular day was really grim. It was grey, it was cloudy and it was rainy. We weren't even sure if we were going to get to the scene of the incident, but it's always worth setting off because there might be a chance that we can land.
35 miles away in the Dales, a motorcyclist is lying injured after coming off his bike.
We think he was travelling at 60 miles an hour, so that's quite a significant speed to come off your motorbike, and we don't know if he's hit anything when he's come off. It could be a wall, it could be another vehicle, so the potential for him to be quite injured is there, so we're going to go and fly along and see what's happened.
The team are racing to the rescue at a pub in remote Swaledale, but the weather could have other ideas.
The Tan Hill Inn is known for being really, really out of the way. It's a pub high up in North Yorkshire, so on a normal day, if the ambulance service is busy, there might not be an ambulance very close by to this gentleman, so with the helicopter we can get to him really quite quick and hopefully get him sorted out.
But the team are flying on the edge of strict weather safety protocols. If it gets worse, they may have to turn back.
Right, okay, the weather's starting to close in a bit. The issue I've got is I'm worried I can't get over the ridge, that end of the ranges. Yeah. The cloud above us is really quite thin. There's blue sky just above us. Right, so my escape option at the moment, now, Lisa, is to go up.
Okay.
You happy?
Yeah.
Any moment now, we're going to break out of this.
Getting brighter, isn't it, again?
That's at 2,000 feet.
There we go, nearly
there. Come out at the top any second.
You're out on the left.
Right, we're out.
Yeah.
But I don't think we're
going to get down.
They've made it through the cloud. The challenge now is how to get back down. To get to their patient, Harry needs a break in the cloud cover so they can safely descend.
This is so thin, this bit here.
Yeah. Is it thin enough to go through it? You can't see how thin it is, can you?
Not until I can see the ground.
No.
I need to be able to see the ground.
There might be a hole, Harry, at 8 o'clock.
Right, okay.
If Harry can't find a place to descend, they may have to abort the patient rescue.
We're now in the valley to the north of the Tan Hill, basically. We're 1,600 feet above the ground.
There's a hole here, Harry.
Yes.
Nice big hole.
Yes, I can see the ground. So we're going to run in, down the hole, and descend through it.
Right. It's good my side now.
Yeah, look at this side. Right, so I'm flying directly towards it. We're 2 miles away from the pub at the moment.
At last, the team are through the cloud.
Let's see what we can find around here. Trying to find somewhere flat enough, is it?
Yeah, it's all a bit slopey, isn't it?
I've got a bit sort of coming up now. I'm going to give about another 10 yards or so. Just going to give that a try.
It's a bit slopey, isn't it?
No, it's not too bad.
Okay.
So about 4 degrees, 6 degrees nose up, well within limits. Happy days.
Lovely, nice one, Harry.
ADS 98, we've landed C.
In the middle of the rugged Dales, the remote Tanhill Inn is Britain's highest pub and prone to the worst of Yorkshire's wild weather.
Hi.
Came off his bike a couple of miles away.
Okay.
Got into the back of a car.
Right.
Brought here.
Yeah.
He's then sat here, not moved since.
Okay.
61-year-old biker Robin Brown is in the care of local paramedics who've just arrived.
No loss of consciousness, remembers everything that's happened.
Yeah.
Left-sided chest wall pain, very tender over his sleeve, and reduced air entry on the lower left.
Okay.
Robin is an experienced biker. His mate's dashcam captured the moment he was catapulted into a roadside ditch at 50 miles per hour.
How does that breathing feel, Robin, now?
It's just shallow, I just can't...
Just because you can't take a deep breath because it hurts?
Yeah.
Yeah, okay. Is that where it's sore?
No, I don't. It's across the front, but it's sore.
Around there. How did you land? Remember?
I went head over heels.
You didn't fly very well?
No.
Robin is putting on a brave face, but he's had a terrifying experience.
What caused you to come off your bike?
I hit a gully on the right-hand side.
Robin's internal injuries could worsen, but with the weather closing in again, the team face a dilemma about whether to fly him to hospital or travel by road ambulance.
It's an hour and 20 to James Cook. I've just Google mapped it. It's not far.
No, I didn't think it would.
And it's an hour 55 minutes to Darlington.
And we're 20 minutes away, aren't we? But we'll have to get a shift on if we're doing it. Okay. So what we've said is we can fly, but if we're flying, we need to go quite quick because the cloud is just on the limit for us being able to go.
Thank you.
We see loads of motorcycle accidents working on the air ambulance. Often they're at really, really high speed and patients don't get away with it. In this situation, because of the protective equipment the patient was wearing, that undoubtedly saved his life.
Where's all that cloud gone?
There's still plenty on the nose.
As the crow flies, it's 38 miles to the major trauma centre in Middlesbrough.
ADS 98 with lifted route in James Cook. Would you just shout the DCA? We just asked them to hold off in case we have problems lifting due to weather, but we're happy for them to go now.
The weather must hold for the 16-minute flight, or the team will have no choice but to divert to another hospital further away. Finally, after a tense flight, there are blue skies over Middlesbrough. This journey would have taken well over an hour by road.
Does your breathing feel okay? Does your
No.
breathing feel normal?
It don't feel normal.
It doesn't feel normal. In what way is it not normal?
Well, I can't breathe.
You can't take a deep breath?
No, I
Is
can't.
that because it makes it hurt?
Yes.
Yeah, okay.
Robin is heading for scans and possible surgery. For the air ambulance team, it's another quick turnaround to beat the weather and get back to base.
Can you just feel the pain in your leg? Have you got any pain anywhere else?
Investigations revealed a tyre blowout at 70 miles per hour caused Gabby Clarson's car to veer off the M62 motorway and roll several times. Today, the 19-year-old has only patchy memories of the crash.
It sort of felt like I'd clipped something, and I remember spinning out and flipping, and then after that it's a bit of a blur. I thought that was it. I thought I'm going to die, and I thought I really hope everybody knows that I love them.
Surgeons at the Hull Royal Infirmary took over 9 hours to repair Gabby's multiple injuries.
I fractured my femur, my tibia, fibula, left side of my pelvis. I've now got a metal rod going through my femur. I've got pins going through my knees and my ankles, and then another rod going down my shin. My friends and family have been my absolute world this year. I think everyone's sort of dealt with it in their own way, but also been as supportive as they possibly can.
Gabby spent 2 weeks in hospital, and it was another 3 months before she could walk unaided. She was lucky to survive the high-speed crash.
I would like to say a huge thank you to the 2 ladies that stayed with me, to everybody that looked after me. And people don't have to be that kind. And it's so sweet that there are people out there that were going above and beyond for you. So, yeah, thank you.
Hello, sweetheart. Well, I'm Rachel, this is Meta.
Scans in hospital confirmed experienced climber Tom Brunt fractured his pelvis after falling 20 feet off the rock face at Stanage Edge in the Peak District. The fracture had to be rested to heal naturally, and within 6 weeks, Tom was cycling and walking. He's taken up climbing again, although he's much more cautious.
Taking a nice deep breath for me.
69-year-old Les Swift broke 2 ribs and punctured his lung when he fell off a stepladder during a spot of DIY at his home.
Reduce air entry on the right base.
Les spent 4 painful weeks sleeping upright while the bones knitted together. He's since made a full recovery.
Is it Richard?
Yeah.
How are you doing? Kit and Neil.
An MRI scan revealed Richard Campbell broke his back when he came off his electric bike on a moorland path and landed on a jutting rock.
Any tingling, numbness, pins and needles?
Just my back hurts.
Richard was bedbound for 10 days to allow the fractured vertebrae to heal naturally. He's planning to get back on the bike when he's fit enough.
Came off his bike a couple of miles away.
OK.
Got into the back of the car.
Right.
Veteran biker Robin Brown has vivid memories of the day he came off his motorbike at 50 miles per hour in the Dales.
We was on a road that we'd not been on before. It looked a straight road. Totally my mistake. I misread. Hit the banking, the bike flew up, I flew off. I just flag a car down, get me a lift up to Tan Hill Pub to phone for the ambulance. I did get to Tan Hill Pub, but not the way I wanted to.
Hospital doctors found Robin had a collapsed lung and a broken leg. He was lucky to survive the high-speed impact.
To get rid of demons and everything else, we went up to Tan Hill Pub. 6 months later, the marks where the bike had dug in, they were still in the bankings and everything else.
Robin spent 4 months recovering and is still having physio.
I cannot thank the air ambulance enough for what they did in them conditions. Yeah, thank you very much. Really, really appreciate what they did.